You know, there's something I want to talk about that I have not heard on this app about GLP-1 medications like Ozempic. I, um, got addicted to pain pills, which I've talked about before on this channel. Uh, hell, over a decade ago. And I had to deal with that addiction for the better part of the decade. Then, as always happens with addiction, you have to decide, I don't want to do it anymore. And I did. And I went and got on Suboxone, which is another miracle drug, just like Ozempic. Um, and, quickly, really, got off of the pills and haven't looked back since. Now, when it comes to Suboxone, it tapers the physical need for opiates, meaning like pain pills. But it doesn't do anything really to get rid of your, mental cravings for those things. You just have to kind of do it yourself and go through a sufficient amount of time where you can get by and just try your best to not mentally crave the drug as much. Okay, so that's where I was at, right? Almost 6 months ago. We're getting closer to 6 months that I've been on Ozempic. Um, and this just kind of popped in my head recently, but I get on Ozempic, right? Does really good for me weight loss wise. And I'm at a pretty big threshold plateau right now, and the weight loss is extremely slow at the moment, but it's still happening. Which is all that matters to me. I just want to keep losing. If it's 1 pound every 2 weeks, which is ridiculously slow, that's fine with me. I just want to keep losing and not gain back. Anyway, since I've been on this GLP-1 medication, I haven't thought about opiates one time. Not once. Now, is that coincidence or, I've been on Suboxone for a few years. Is the Suboxone extremely slow to react on the mental side? I'm not a doctor. I don't know any of the answers to this, but being someone who has dealt with Suboxone and trying to do things cold turkey, and now being on being on Ozempic for weight loss, it definitely is having an effect on the addiction side. I legit do not think about it anymore. Like I don't think about food, which I don't. And at the same time, I don't think about my previous opiate addiction. Food, when you got as big as I did, was an addiction. Pills, when you were on them like I used to be, was an addiction. I kind of think Ozempic, rather than being a diabetes drug, or maybe not rather than, but as well as being a diabetes drug and a weight loss drug and an anti-inflammation drug and about 5 other things, it could also be an anti-addiction drug, which to me is absolutely amazing. Now, I could be just talking out of the wrong side of my face here, but I don't know, man. It seems like it very much could be the case. And if so, that's pretty damn amazing.